Now, it's not only painful, but it's also a common cause of infertility, yet a lot of women don't even know they have it.
Endometriosis.
Endometriosis is a common ailment affecting as many as 1 in 10 women.
Endometriosis is a painful, debilitating disorder that affects nearly 200 million women and girls.
Frustrates doctors and patients alike because it often goes misdiagnosed. Meet one woman who struggled 10 years to find the cause.
I knew something was weird. I knew something was wrong, and I needed a doctor to confirm what was going on.
I got to the point to where I just asked God to take me.
It's ruined friendships. It's ruined relationships. It makes me moody. It makes me angry. It makes me feel sorry for myself. And I try to keep that all inside, but sometimes it's too much.
I remember a doctor asked me if my mental health was okay, because it's like an invisible pain. They do CAT scans, they do all these exams, and they can't find it, but I'm still complaining.
You become a silent sufferer. You stop expressing your pain because you're being told your pain is normal.
Because endometriosis is such a complex disease with so many different components affecting it, all these different things affect different people in different ways.
Endometriosis is like a big puzzle. We have many small pieces of puzzles. And those puzzles seems to be validated. They all have something there can support it, but they cannot explain the whole picture.
Endometriosis actually is a systemic disease, and by treating the spots, you're not getting to the source of the problem.
We clearly know there's a genetic component. The women whose mother or sister has endometriosis are about 7-fold increased risk of having it themselves. We're trying to get at the biology, the real molecular basis of endometriosis. Where does it come from? One thing that's troubled us for many years is sometimes we find endometriosis in very remote places, in the lungs or the brain. There were even years ago reports of endometriosis in men. These were men being given high doses of estrogen for the treatment of prostate cancer.
So the ASRM classification does divide endometriosis patients into 4 groups, simply labeled 1, 2, 3, and 4. 4 being the most severe. While it's generally true that the more disease, the more pain and the greater number of surgeries that you tend to run into at a given patient, there is no particular lineage of pain correlation with observable disease. There are perhaps as many as 1 in 10, 2 in 10 patients who have stage 4 disease and no pain.
Stage 1 is just a description of what a lesion is. It's not a description of how bad the disease is for the patient. And I hope that we get away from the staging system that makes some patients feel like second-class citizens because they only have stage 1, when in fact their symptoms are a very serious situation.
Oh gosh. I've seen probably at least 6 doctors.
I've heard everything. The first time I went to the emergency room, they told me I was allergic to milk. They've told me to go see a psychiatrist. They told me it was all in my head.
A lot of times they just didn't know. It was just, this is what happens with girls and women, and you're just gonna have to take pain meds and move on.
Mostly what I heard was that painful periods are normal and it's nothing to worry about.
They thought I was a drug seeker at one time because I would constantly come in with pain.
There's this incredible experience of going to all these different doctors and feeling like you're the problem. It's got to be in your head, and there's all of that going on. So you want to find someone to help you, but the problem is who? Very few people honestly know what they're doing with this disease.
The issue that has always been underlying all of this, oh my God, is it in her head or is it real? Well, it's always both, because there's an emotional reaction to the pain and the frustration of not being able to find somebody who at least listens and helps find resources.
Lots of women suffer and think that it's supposed to be that way. And then they ask someone that's trusted, a family member, who says, you know, I suffered, your grandmother suffered, it was sort of the curse of our family, or lots of people suffer. So we don't have a relative idea of what's normal.
Women are taught for millennia that when you have your period, that is normal, pain is normal, that is part of the womanhood. Pain is not normal.
I went 18 years thinking that this pain all the time was totally normal.
20 plus years.
More than 15 years?
20 plus years.
22 years.
13 years.
6 years.
13 years. 12 years.
10 years.
13.
6 years.
13 years.
I probably saw about 10 doctors for my symptoms, maybe more. It's hard to keep track.
I think that sometimes, you know, maybe doctors will get a diagnosis in their head and they'll stick with that and won't look beyond that.
So I'm sure you hearken back to the times that you were in physicians' offices and you were telling your story and nobody listened. Like they were listening, like nodding their head and yesing you. To be honest with you, as a clinician, half of the problem that we run into when we see patients who may have this condition is we don't give them enough time to share their story, we don't listen, and we don't communicate effectively. I tell you, one thing I learned when I was a fellow is 90% of the time, it's the history and the physical alone that will help lead you to the diagnosis.
I bounce from doctor to doctor. They do, you know, whole lab panels, blood work, they do imaging, and then they would tell me I was fine. I was told it was in my head. I was told I just needed to learn how to deal with it. I was told that I would get used to it someday, but no one ever could tell me what was wrong. I started to think that it was me. I just couldn't handle, you know, being female.
Diagnosis of endometriosis is difficult, and it's difficult for a lot of reasons. Scanning and diagnostic studies, laboratory work, none of that provides the ability to rule out endometriosis. The true symptomatic profile isn't well known, isn't well taught. Many people do not seem to be aware that endometriosis can cause severe bowel dysfunction. People get nauseated, they get diarrhea, they get constipation, they get severe bloating, they get pain with bowel movements, they get pain with sex, they get pain with a full bladder. All of those things kind of get set aside.
The associated conditions typically include irritable bowel syndrome, interstitial cystitis, pelvic floor muscular dysfunction, thyroid problems, chronic fatigue. There's a gastritis, all the different itises, all the different inflammation.
And then there's a lot of just systemic or overall symptoms, you know, the fatigue, the kind of fibromyalgia, almost like symptoms, joint pain, just feeling sick or like there's just some kind of poison in the body.
For me, the pain is like, it feels like somebody's cutting my thigh off, or at my hip, with like a dull blade, and they just saw it off repeatedly over and over again.
It's not that you can just take Tylenol, it goes away.
Crippling pain.
Things you're not really supposed to even think about that you're doing would stop me and fold me over in pain.
I would have hot flashes, I would have chills, I would have rectal bleeding.
Migraines, fatigue.
It was difficult to walk, it was difficult to sit up.
It just feels like someone is taking a roller and rolling up my insides, and it's tighter and tighter, and then rubbing barbed wire through it.
Historically, medicine has really separated mind from body. You have your psychologist and psychotherapist that you see for the mind, and then you go to your physician for your body, and they really separate it. It's so important to bring those aspects together.
Part of our understanding now is that the brain is an interactive mechanism. So when we have pain, we isolate. There's a lot of reasons for that. A, I don't feel good, so I don't necessarily want to show up and look less than I used to look. I don't want people to judge me. Or over time, when you have chronic pain, you don't know what to say anymore. People say, how are you doing? And you don't want to say fine because it's a lie. And you don't want to say the truth because you don't want to depress other people, not to mention depress yourself. You don't want to admit it on some levels.
Pain causes suffering. Suffering causes depression. Depression can then feed back into pain. And so they're interrelated on a emotional, physical level, but they're probably interrelated on a biochemical and mind-body level as well.
I kept hearing, condescending remarks of what you have isn't a big deal. It's just cramps, or, have you thought that maybe you're bipolar, or maybe you're a hypochondriac, and it just killed me.
Family members that are not very supportive. You lose a lot of friends because you can't keep up physically with them.
Living through the pain, I sometimes can deal with, but it's really hard to deal with the aftermath of the pain, the way I reacted to the pain in my life and my situation. So I think that's a really hard thing to deal with.
Stress is a big factor. What happens when you're under a lot of stress? The body produces stress hormones, cortisol. When the cortisol rises, it also increases the cytokines, which is an inflammatory protein that causes inflammation. So stress has a direct correlation to inflammation.
So you think about how you feel emotionally when you're in pain, and how can you separate that? The more stress you're under, the more tension you feel in your body, and the more tension you feel in your body, the more pain you feel in your body, and it's really hard to unwind that once it gets caught in that spiral.
While stress plays a role, there's a difference between stress plays a role and stress is causing this. And I can see so many women are told it's stress and it's really disease that needs to be better managed.
We went to the gynecologist, and of course, I'm 16, I'm terrified. And they said, you have a normal period, everything's fine. We're gonna put you on Yasmin, and it'll help your symptoms decrease. And so I thought that, I believed that. A doctor telling me this, it has to be true. And then it became pretty evident that it wasn't true.
We do see young teens with endo. So is that crazy, or does it make sense? Well, if you think about it, it's an estrogen-dependent disease. When does estrogen start in a woman's body? As she starts to develop breasts. That's when the symptoms may start. So it may start even before she has her first period. The pain is different sometimes in adolescent women versus adult women. And that can be tricky for primary care providers, for gynecologists, nurse practitioners, in that they may have been trained to look for endometriosis with pain with periods. But for an adolescent woman, she may have pain in between her periods, pain with her periods, or pain every day of the week. I usually suggest that women think about, can they do their best? Or are they disadvantaged by their symptoms? If they're disadvantaged, that's not normal. They shouldn't be missing school. They shouldn't be in pain to the point where they're cranky or don't want to participate socially in what's going on in their lives. that's when we need to listen to them and move forward.
When you're just starting out and you're going through teenageness, which is a very difficult time, your hormones are going up and down, you're trying to define who you are as a person. If you're looking at your peers very carefully, they're looking at you very carefully. You don't want to stand out in a negative way, and yet here you have this pain, this thing that's stopping you. You're feeling older than your young years.
I think it's hard to have a chronic disease, no matter how old you are. But if you're a teenager and you have a chronic disease that involves your female reproductive tract, and most kids your age, if you're a 12 or 13-year-old, feel uncomfortable talking about reproductive issues, makes it a difficult situation.
What I try to tell parents of teenagers is the most important thing you can do is be there emotionally for your daughter. Meanwhile, start reading everything and, question. Sit in front of the computer and look at some of the things online and question with her.
When I went to school in the 80s, I was taught that endometriosis was a career woman's disease. What does that mean? It meant white women who had insurance, you listen to their pain. It's pretty sad.
The idea that it was career women's disease, that stereotype was constructed around a profile of a white professional, highly educated, probably high-strung woman who has not had children, right? So already you can see what kind of stereotype that is. And the argument was that's what this disease is about. And the implication of that is the best treatment is to immediately have a child, right? Whether or not that works for you, or a hysterectomy, neither one of which proves to be a good solution.
Pregnancy is not a cure for endometriosis. It's another myth. And yeah, some women, their symptoms get better afterwards, but some women don't. And I think it's really inappropriate for doctors to be recommending that as treatment. And I know a lot of women with endo are told that even when they're single, even when they're young. Bringing a child into this world is not a medical treatment. It's a really important decision for a woman and a couple to make.
I do see 15, 16, 17-year-olds who come from other healthcare providers who are frustrated, and the families are frustrated, and they're told they need a hysterectomy. I think that's criminal. I do not think we should be removing the reproductive tract of young women, or any woman, until she herself has decided she has completed childbearing.
If there's estrogen and the peritoneum with the disease is left, hysterectomy will not help. Removing the ovaries will not help if you leave the disease behind.
There may be up to 20% of those women that have recurrent endometriosis even after they've had their uterus and ovaries removed. And specifically those women who are treated with estrogen after they've had their hysterectomy may have recurrent endometriosis, perhaps as high as 40% who are treated with estrogen.
The medical treatments of endometriosis are really based on hormone manipulation. And the strategy is either to reduce estrogen or increase the ratio of progesterone to estrogen or push them both down. Usually the first line is birth control pills, as it steadies out the hormones. You can eliminate the periods often for months at a time, and that may, temporarily at least, take care of the symptoms, and the side effects for most but not all women are minimal.
Because estrogen is a hormone that drives the inflammatory response and the progression of endometriosis. And progesterone is like the dampening hormone and kind of suppresses the further development of endometriosis.
The next steps are kind of a big jump. You know, we look at things like Lupron, which basically alters the brain chemistry to turn the ovaries off. The Lupron temporarily suppresses, if it does suppress, the endometriosis. So it's like your lawn in the wintertime. You know, it doesn't look too good, but you give a little water and some sunshine and it's back. It's like any other treatment. You know, you really need to understand the pros and the cons. And the plus column needs to outweigh the minus column. And unfortunately, it seems like for a lot of these patients, it doesn't.
When I was on Lupron alone, it was a 6-month course, and I didn't know what was going on. My doctor just told me that I would have hot flashes, and it was, that was not the case. That was bad. That was very, very bad. And I bet I saw 8 doctors just in that 6 months of, oh my gosh, this is crazy. I just came in for pain, and now I have joint inflammation. I have night sweats that were just unbelievable, mood swings that were horrible. I can't believe I didn't get fired a couple times with some of the things that I did, or some of the things that I did that I could have gotten arrested for.
The way that we practice medicine is not conducive for what women with endometriosis need. It's a chronic problem, a chronic systemic issue, and it needs solutions that are long-term, but not Band-Aids. And using the hormones and all of those other things, those are Band-Aids.
What I think we really need are drugs that attack some of these molecular pathways that aren't hormone suppressing drugs, that aren't just with a broad brush trying to stop every reproductive function. All of our treatments now essentially work by blocking estrogen, which stimulates the growth of the endometrium, or by giving more progesterone, which stops it from growing. They have side effects. Women are supposed to have estrogen. You feel menopausal if you block it. Too much progesterone. Progesterone is the hormone that leads to PMS. Essentially, you give a lot of that, and some women you're going to get PMS-like symptoms. We need non-hormonal treatments, treatments that are specifically targeted to endometriosis.
There are a lot of good studies that tell us that by and large, if you had to choose one treatment approach for endometriosis, it would be probably laparoscopic surgery. But it's also important to know that this surgery is not easy to do, and patients really need to be seen by someone who has experience and skills with it.
You want to make sure that your surgeon is not only going to do a laparoscopy and diagnose the disease, you want to make sure that at the same time they're going to treat the disease and they're skilled at treating the disease.
It's important to ask them what their complication rates are. You should ask the surgeon what their outcomes have been. Ask them if they work collaboratively with other specialists when they're in surgery. I mean, those are important pieces of the puzzle that the patient should put together, and they should never be afraid to ask those questions. And if a physician is hesitant to share that information with you, then that should be a red flag.
Endometriosis surgery has loaded with complications. It's more complex and riskier, 7 to 8 times riskier than any other surgery, because it involves multiple organs. 1/5 of the time bowel is involved. Almost always pelvic side walls are involved. So it cannot be done by regular gynecologists as a routine surgery. And I can underline this. It cannot be done by doctors who are delivering babies till 4 o'clock in the morning and scrubbing at 8 o'clock to going to an endometriosis surgery.
The problem lies in so many people don't know that endometriosis can have so many different appearances. So there's so many laparoscopists, or gynecologists rather, around the country, around the world, who take a patient to the operating room because they have pain, but they don't know the different appearances. It can be blue, it can be black, it can appear yellow, it can be fibrotic. We can't just put a laparoscope in, take a look, at a lesion and say, oh, that woman has endometriosis. The only way to make the diagnosis of endometriosis is by removing the endometriosis, sending it off to pathology, having the pathologist look at it under the microscope, and confirming that the endometriosis or that lesion has endometrial glands and stroma. We certainly need someone to cut out endometriosis. Excision of endometriosis really yields much better relief for those women because you're removing the endometriosis. If you leave endometriosis behind, you're leaving something foreign in the female pelvis that's just going to continue to cause pain or even worse, cause adhesions. How one does it, whether they use scissors or a laser, the tool doesn't make the difference. It's whether the surgeon is excising it or just burning the surface of it.
So this is the key of endometriosis surgery. When you remove or destroy a tissue with energy, you leave a burned tissue behind. That burned tissue, at times it has still residual endo in it, but more of it, you leave a fibrotic scar tissue behind. That was the soul of endometriosis itself.
Endometriosis shouldn't be the path of 15 surgeries. It should be one surgery done right.
Seeing the pictures of what they found when they opened me up was pure vindication for all the years that I fought for myself and knew that what people were telling me was shaming me and making me feel like I was bipolar or I was crazy or overly emotional. It was vindication for me, and I saw firsthand how my ovaries weren't where they're supposed to be. One was stuck on an intestine. My appendix was covered in endo, and they had to take that out. It was all over, and those 4 hours of operation gave me now a 60 to 70% chance of being able to have a child on my own.
There's definitely a strong association between endometriosis and infertility, in that if you look at the infertile population, the prevalence of endometriosis is significantly higher than in the fertile population.
Endometriosis can cause infertility in a number of ways. First of all, there's a structural component. The endometriosis distorts whether it's the fallopian tubes or the normal pelvic anatomy. And secondarily, there's an inflammatory component. So endometriosis causes so much inflammation that it makes it difficult for either the egg to get to the tube or the sperm to get to the egg. Or if they actually do meet, there's so much inflammation that the egg and the sperm don't implant properly.
This reaction produces a lot of cells and chemicals and cytokines and other chemicals in the pelvis that make it an unhealthy place for the sperm and egg to work the way they should.
Excuse me, it's just, I get emotional, but it's really bad, especially when you want to have children and you can't have kids. And endo robs you of wanting to have a child.
That's hard to hear at 13, considering you're still a kid and you always have dreams of having kids and getting married and having the white picket fence and happily ever after.
In my group of patients that I'm working with, I frankly encourage all of them to get their endo excised before they enter fertility treatments. The reason for that is I've seen many spontaneous pregnancies occur once the disease is done. They don't even need the infertility work.
There's lots of things that guide patients' decisions as far as what's the optimal fertility treatment. And it's not always just the treatment that's going to give us the best chance of success, because emotionally, there's a lot of considerations to make. Fertility treatment takes a lot of time. Cost plays a role. So everyone's coming from a different perspective.
Even after surgery, you still have the disease, and you got to know the disease well. You got to know your own enemy in order to manage it.
The non-surgical part of endometriosis really is dealing with restoring health. The surgical part can remove disease, but lack of disease does not equate health. And again, this is an area where Western medicine just comes short.
Patients need physical therapy after quality surgery for endometriosis because even though the disease has been cut away, all the other surrounding pain generators are still there. And so if your pelvic floor has been spasmed for, say, 6 to 10 years because of diagnostic delay, it's still going to be in spasm even after we remove the disease.
By getting rid of the trigger points, by calming down the nerves, that is what calms down the pain. It calms down the pain pathways. If a nerve is restricted, or muscles or tissues are restricted, or even an organ's restricted, it can send messages to the brain that there's pain. So what the physical therapy does is it helps release the tension in the muscle, the restrictions. It helps the nerves glide better. So that in itself can help decrease pain.
Women that I see with endo, with chronic fatigue, fibromyalgia, irritable bowel, all of these things, they all have the same fundamental issue, which is inflammation.
It's a inflammatory disease. If you look at it from that perspective, it's inflammation and it's awful.
So addressing the inflammation is really important, and how we address that inflammation is variable. There's nutritional approaches, there's herbal approaches, there's exercise, there's mind-body aspects of just calming the mind down.
It's multifactorial. So you just can't do one and expect things to work. And in fact, you might try one and nothing happens, but it's happening inside your body, you just can't recognize it.
In terms of treating endometriosis with Chinese medicine, it is definitely okay and often recommended to combine it with Western medical treatment. And the nice thing is that Western medicine and Chinese medicine are coming at the problem from such different angles. They actually complement each other really well.
The goal is the same. We're trying to get the body back to health and optimum functioning. And the body is capable of doing that. And what we're doing is we're basically supporting this restoration process. We're not doing it for the body. We're supporting the natural, healthy normalization process.
The goal is whatever will return a woman to function. You have to figure out what the trigger is for your endometriosis. People ask me, can I still do sports? Can I not do sports? I've had patients with endometriosis teens who have been Olympic athletes. I have others who find that their pain gets worse with physical activities. I don't think we can generalize, but I think we all need to find out what works. Is it heat? Is it relaxation? Is it acupuncture? Is it just taking an hour and smelling something that's pleasant and having a massage? Everybody responds differently. The goal is to make you functional.
Let's start with sleep. Sleep is often just forgotten, and it's really number one, because if you're not getting sleep, you're not going to feel well. Number two, actually, is cleaning up the digestive system. You're not going to be able to absorb nutrients unless your intestine is working.
Basically, our immune system starts in our gut. In order for the immune system to be healthy, the digestion needs to be healthy. We have a symbiotic relationship with the flora in our gut. We cannot live without the bacteria that lives in our gut and helps us digest our food. Most, I would say 80 or 90% of my patients with endometriosis, if not all, have food sensitivities.
We're not talking about the kind of allergies you get with shrimp or seafood where you eat it and all of a sudden your lips swell up. We're talking about mostly chronic fatigue, achiness, the sorts of things that often go along with endometriosis. The food allergies form because food particles can get through the intestine and come in contact with the immune system, which it normally does not do. And so it causes more inflammation when you have food allergies. If we can take away the foods that are responsible for the allergies, then we can start working on decreasing the inflammation, because that's essentially what we're trying to do.
So one of the ways we treat endometriosis is to calm the immune system down. And we do that through diet. That's one of the big ways we do it.
Things like coffee, sugar, red meat, dairy products.
Sweets, dessert, candy, muffins, cookies, juice. It's perfectly fine to have 1 or 2 pieces of fruit a day, but if you have more sugar than that in your diet, it's probably too much. Sugar is like an inflammatory agent. If you don't believe me, you can try it for yourself. You can binge on sugar for 3 days. Whatever little aches and pains you have, whatever little problems you have will invariably feel worse. If you get off sugar, the inflammatory process slows down in the body. The modern processed American diet is furthering that inflammation and accelerating the disease process. Processed food is so ubiquitous in our culture that I actually have to explain to people what I mean by that. And I mean things that are pre-made and packaged and canned that come out of packages and cans. If you have to use a can opener to open it, it's processed. So you buy canned tuna and you think all you're getting is a can of tuna, but they actually use milk protein to stabilize it. And it's not on the label, at least not in the United States. So you never really know what's in the food you're eating if it's processed.
What we worry about is for example, the corn in our diet. So corn oil and corn syrup, if you read the ingredients, is in everything. And if you track the increase in these sort of inflammation-related diseases, obesity, etc., it almost tracks with the point where we started doing that.
When you look at the diets that so many people have, it's a wonder that they're even standing up. You cannot keep feeding your body junk and expect that it can prevent disease or heal you once you are sick. There is one caveat on diet and endometriosis. There's no one endometriosis diet. So what may work for one person might not make any difference for another person.
I've tried pretty much every diet in the book, trying to treat myself. I've tried paleo, I've been vegan, I've been vegetarian, I've cut out soy. I've pretty much eliminated every typical allergen that there is. Even after surgery, I was experiencing some difficulty with digestion, and I finally consulted with a nutritionist and came up with a plan that was right for me, and that's made a huge difference. There are some supplements that kind of rise to the top for me that come up very often. One of them would be fish oil, is something that is so important.
It's not a panacea. If you're eating a lot of fast food and a lot of fried food, you can't go home at night and take fish oil and think, oh, everything's going to be fine. It's really a lifestyle.
A pill is not going to solve everything. You have to exercise, you have to do the best that you can to maintain a healthy lifestyle, because you're just going to feel better.
It's interesting that if you look at certain graphs, like the chemicals in our environment, autism, asthma, endometriosis, it all parallels our use of chemicals.
I'm coming from Taiwan, and I remember in the early 1970s, one day one of my attendings was doing surgery and found out the patient had severe endometriosis. He stopped the surgery and called all the OB/GYN staff in the hospital, come to the operating room to look at it. What is it, severe endometriosis? Because we simply did not see many severe endometriosis, which is very rare at the time. But if you look at if you go back to Taiwan now, We have tons of endometriosis. Almost every day, every hospital have it.
So in 1992, I tracked down a colony of rhesus monkeys where 2 monkeys had died, and they discovered that the animals had died from endometriosis. I brought in top experts to do laparoscopies, and at the end of the day, they broke the code. 79% of the animals exposed to dioxin had developed the disease, and they developed it in a dose-dependent relationship. The more dioxin, the more severe the disease.
As a theme, endometriosis is considered to be estrogen-driven. So we know there are receptor sites for estrogen on the endometrial growths. There are environmental toxins that act like estrogens. They're considered xenoestrogens. They are considered to be very strong estrogens. Actually, they bind to receptor sites and have an influence thousands of times greater than what our own natural estrogen has on our body and on our tissue.
So when these hormone disruptors get into the body, they mimic our own hormones. And every cell in our body have receptor sites. So you think of that as like a keyhole into a door. And the endocrine disruptors or hormone disruptors, they basically make their way into these receptor sites and take up space. They can magnify our own hormone function, they can block our own hormone function, and they can just alter the way our hormones function altogether. So think of it like as your own hormones. If they were to take up space on your cells and they were to unlock that door, they're sending messages into the body on, what to do, how to protect the body, what is the function of the body, whether it's thyroid, testosterone, estrogen, any hormone. But if we take in a chemical that mimics estrogen, say for example, and then it blocks it, it's like putting a key into a rusty keyhole and the door never opens. From the moment a person wakes up, we are exposed to these hormone disruptors. I'll just give you an example. You get up in the morning, the first thing you do is brush your teeth, and most people's toothpaste has fluoride in it. And many of them are flavored with aspartame and other artificial sweeteners. Then you jump into the shower, and your soap probably has fragrance. And the word fragrance can entail or could include hundreds of different chemicals that we don't even know because they don't have to tell us what those are made up of. And then you use your shampoo, you use your conditioner, we've got parabens, and we know that the parabens mimic our estrogen. So there you are in the shower, your pores are wide open, you're just absorbing all of those chemicals that are known to disrupt your hormones. Then you get out of your shower, you towel off with probably a towel that you washed in a washing machine with fragrance in the soap, and if you've dried it in the dryer with those fabric softener sheets, those are filled with chemicals. And then you're dried off, what do? You lather up with some more lotion, and you've got more parabens, more fragrance. And then your makeup and your fingernail polishes. I mean, it can go on, and you haven't even left the house yet.
The idea is, how can you decrease your chemical burden? I mean, we can't change our environment, certainly not overnight.
You can change what you're exposed to in your own home. And just by knowing that where you spend most of your time is very clean, then your body's stronger for when you are assaulted with those external chemicals when you go out into the world.
You can avoid chemicals by not necessarily eating everything organic, but there's certain fruits that, in particular, that have a very, very high level of herbicides and pesticides. And if you go organic for those fruits and vegetables only, then right there you're decreasing your level of toxins. So we can't remove everything, but we can decrease our body burden. And that's real important.
There is no way in today's world where we can rely on anyone to take care of us. There's just too much politics, too much money involved. We have to take charge of our own health. You can shop locally, you can talk to your farmers, you can grow your own food, you can seek out holistic practitioners who will help guide you into the resources you need to protect you from this. Now, the Environmental Working Group has a website where you can go in, and it's called Skin Deep, where you can search it by cosmetic database, and you can put in your body care products, whatever lotion or shampoo you have, and they rate it from 0 to 10, and whether it's a low hazard, moderate hazard, or high hazard. So then you can start cleaning up your body care products, and it can be very daunting for people. So I always caution my clients to not get overwhelmed and give up, but think about what's the first line of defense. What are you exposed to in the morning when your pores are open in the shower? Your shampoo, your conditioner, your body soap, your body lotion. Start with those first 4 things. And then if you've got highly toxic body care products, dump them and just get some clean ones. And they offer, at the top of their website, they have a huge list of clean products. So if you don't know where to start to go replace your products, it's right there at your fingertips.
It's not really rocket science. I think it's something people could take, care of themselves and control over their own health. I think this is the answer to me for the toxicant world is avoid learn where the toxins are coming from, avoid those, change your diet, and you'll do yourself a world of good.
When you are diagnosed with endometriosis, or if you think you have endometriosis, you simply must do your homework. This is not a disease where you can throw yourself at the feet of a doctor and say, cure me. Only you know your body. The disease is highly individual. So what might have worked for your friend may very well be the worst thing for you. You have to understand that with this disease, there are not clinicians who will lay out a whole smorgasbord of options. When you choose your physician, you are likely choosing your treatment. If you choose a physician who is a surgeon, you are very likely to end up with surgery. If you choose a physician who likes, the drugs that are out there, you are very likely to end up on those.
Doctors don't have all the answers. I will admit that. I admit that to my patients. Like, I can't know everything. I can't know all the answers. And I certainly don't know what it's like to live your life every single day also. No one is going to know your body inside and out as much as you do. Ultimately, the highest level of wisdom comes from inside your body. You are the expert.
Be persistent. Educate yourself as much as you can about the disease. I had myself 5 surgeries that were ineffective with a surgeon who wasn't treating the disease properly before I got to the right surgeon. But once I got to the right surgeon, my disease was managed much, much better.
So many doctors just want to calm the symptoms down and not treat the problem. And even though there are only a few of them, there are excision specialists who can help you and can get you pain-free. I had surgery 4 days ago, and I feel better than I have in years because I found the right doctor.
It does get better. You will get to a point in your life where you'll feel you have learned something from the experience, and you are learning something. You're getting tough. You're getting really tough so that you'll be able to deal with other things that come down the pike.
I don't think that women give themselves enough credit in knowing that they are in charge of their own physique, they know their own body, and they know it well, and nobody can tell them different. I think that we have a tendency as women really to subvert our pain and put everybody else ahead of us. Fight it like it was for someone else's battle. Fight it like it was your kid's battle. Fight it like it was your parents' battle. Fight it like it was your best friend's battle. Because if you're not well, you can't be good to anybody around you.
Speaking up about the disease matters. Diseases that get a lot of attention, a lot of publicity, where Congress knows about them, tend to get more funding, more help, faster relief.
Endometriosis puts a burden on society of an estimated $119 billion annually in associated lost productivity, associated care, hospitalization costs. So this isn't just a disease of women with painful periods, this is a societal disease.
There are a lot of women who don't see a way out, and they just, live with tremendous sadness and discouragement, and that's really unnecessary. Women need to be empowered, and they need to be empowered with knowledge and information, and know that you don't have to live with it. There are more that you can do than just accept what the doctor says, live with it. Just live with it. And I like to tell those doctors, how about you live with it?
Until the group that is affected stands up and says, enough already, it will not stop.
Give yourself a break. You know, appreciate that really the vast majority of the time, you're right, you're just in a bad situation.
Don't accept what 1 or 2 or 10 doctors tell you is normal when you know that something is wrong.
Do as much as you can to learn about your symptoms, learn about possible treatments.
Get second opinions or third opinions or fourth opinions.
Keep pushing until you find the right provider. They are out there. Find a place that understands you and will listen to you and where you feel supported.
Listen to yourself, fight for what you need to get, and there is hope. There is life after endometriosis. It is possible.